following are precautions for patients with a total hip replacement. When the patient is supine, maintain the surgical hip abducted from the midline of the body and in neutral rotation. The hip should not be adducted beyond the midline of the body when the patient lies, sits, or stands. Maintain the surgical hip in neutral extension. The hip should not be extended beyond the mid-position of flexion and extension. Maintain hip abduction and neutral rotation while the patient is in a sideline position on the unaffected hip by supporting the surgical lower extremity on pillows or a bolster. The surgical extremity must be in the uppermost position. Avoid external hip rotation when an anterior or anterior lateral surgical approach was used. Avoid internal hip rotation when a posterior or posterior lateral surgical approach was used. Avoid rotating or twisting the upper body with the lower extremity fixed or immobile. Avoid hip flexion beyond a range of 60 degrees. This means the patient should not sit erect in a wheelchair or in bed. Bringing the trunk closer to the thigh produces hip flexion. Avoid excessive trunk flexion while the patient is sitting. Use an elevated toilet seat and an elevated chair when available. And you just had a total hip done on your right leg?
Yes, I did.
How are you feeling today?
Oh, sore, but okay.
Okay. Well, the plan today is we're going to get out of the bed. So I'm going to help you learn how you can get yourself sitting at the edge of the bed. And then we're going to work on going into the wheelchair.
Okay.
And do you have any questions?
How much weight can I put on my leg right now?
Well, the doctor said that you can put as much weight as you can tolerate. So as, how it feels for you, that's how much weight you should put on.
Okay.
And I want to make sure we review your precautions. Do you remember what your precautions are?
I think so. I can't bend it past a certain degree.
So you don't want to bring your knee up so it's past 90 degrees.
Okay.
Okay, and you don't want to cross your legs.
Okay.
And you want to make sure you keep those toes pointed straight up to the ceiling.
Okay.
All right. So now your arms are really strong, right?
Yes.
So as we're sitting up, what I'm going to do, I'm going to raise your bed up just a little bit.
Okay.
And then you're going to have your arms and you're going to be able to push yourself up into a sitting position. All right. But at the same time, we're going to be pivoting you on your bottom
Okay.
as we're bringing your legs over the edge of the bed. Okay, so before we get up, I'm going to put what's called a gait belt on. This is just for precautions to keep you nice and safe, okay?
Okay.
So I want to make sure that, if you were to lose your balance, I can help you out with it.
All right.
All right, so we won't put it on too snug. All right, now I'm going to raise your head up just a little bit and bring that bed up just a little bit too. All right, so I'm going to guard this leg. You're going to be pushing off with your arms, and we're going to pivot you around on the count of 3. 1, 2, 3. Now I'm going to lower your leg down nice and easy. There you go. Now I'm going to get this chair just a little closer so you don't have to go so far. And here's your walker. And I'm going to stand on your weaker side here while we're standing up. I want you to push off the bed on the count of 3. 1, 2, 3, and then hang on. Good. Now we're going to take little steps around. And then back yourself into the chair. Wait till you feel the back of that chair against your leg. Now reach back to those armrests and lower yourself down. Kick that leg out just a little bit. Nice job, Linda.
Thank you.